Afternoon, everyone, and welcome to the Northwestern Melbourne Primary Health Network session on the introduction to COVID monitor for practice managers. My name is Claire and I'm part of the workforce development team here at the PHN and will be facilitating the session today. Before we begin, I'd like to make an acknowledgement of country. The Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognise their continuing connection to the land, waters and culture and would like to pay our respect to elders past, present and emerging. Just outline some brief housekeeping for this afternoon. Participants will be muted for the duration of the session. However, if you do have questions, you can pop them in the Q&A and we'll get to them at the end of the session, and we'll enable the raise hand function. So if you'd like to come off mic to ask, off mute, sorry, to ask a question, we can facilitate that as well. Please note that the session will be recorded and all questions in chat will be kept anonymous for your privacy. We do ask if you can change your name in the Zoom webinar so it reflects what you had registered with. If it is different, however, you can message us at NWMPHN Education through Zoom or email, which has just been popped in the chat. A brief agenda for the session today. So we have myself facilitating and we'll have my colleague Bianca do a demonstration on COVID monitor and then wrap up with some questions. And now I'd like to introduce Bianca, who works as a Director of Primary Healthcare Improvement here at the PHN and who will lead the session today. Thanks, Bianca.
Thanks so much, Claire. If we can just go to the next slide. Excellent. So thanks so much for joining us today on a bit of an introduction and walkthrough to COVID monitor. Thanks so much for joining us over lunchtime. I know now is an incredibly busy time in general practice, so really appreciate you taking the time to watch this live. This will also be available as a webinar recording on our YouTube site as well, hopefully from tomorrow, but definitely by the end of this next week, so it can be shared with others in the practice as well. Just, I'm sure most of you on the call are well aware of the West Metro COVID positive pathway, but I just put up this slide just to, I guess, refresh all of your memories. And for anyone new in the audience who hasn't, their practice hasn't had any patients as part of the model. Really just, I guess, to emphasise that the COVID positive pathway in the West Metro region really looks at patients in the that are deemed low risk for COVID. So COVID positive patients deemed as low risk are actually streamed to GPs for care. Medium risk is looked after by hospitals, so in virtual care settings, either virtually or hospital in the home, and then high risk is inpatient care. So just to flag that COVID monitor, you can see down the bottom there, is replacing the Redcap system, but the pathway remains unchanged in terms of sort of GP role as part of it. Thanks, Claire. Next slide. So what is COVID Monitor? It's a secure online portal that we're hoping will help in the management of patients with COVID in practices, and particularly those practices that are looking after a large number of patients. It allows you to view all the patients enrolled in the model from your practice in one clear dashboard. One of the big differences of COVID Monitor compared to the current system in Redcap is it has self-reporting symptom monitoring for patients. And what we're hoping is that that reduces the burden on GPs needing to call patients every 2 days and gives a little bit more flexibility if the patient's reporting symptoms to see how they're managing, and if they're actually tracking okay, then GPs can make a decision as to how often they wish to contact that patient. So it has the ability for practices to view a list of COVID-19 positive patients associated with your practice. And I'll go through the reports that you can see in a moment when we walk through the system, but it will allow you to look at those that are both in your care in low risk, but also anywhere in the pathway. So we often get questions from practices around, I know that, this patient I'm looking after, their husband is in hospital, but I'm not sure which one. You'll actually be able to see that within the dashboard, presuming they're also within the West Metro pathway. You'll be able to see individual patient details and timelines. So the date of the swab date, so the date of the positive test, symptom history over time, and also clearance dates, which we're hoping will be a lot clearer for patients that have a lot of questions around when they're going to be cleared, etc. You can set up scheduled follow-up if required. And I guess it's important to mention here that the system currently doesn't integrate with practice management software, and we absolutely appreciate that that is going to be an issue and an additional sort of barrier. This COVID monitor is in use in the Northeast pathway and the Southeast pathway in Metro Melbourne. But both of those pathways really haven't utilised general practice as much as this pathway has. So we've had a huge number of patients. So about 3,500 patients have been managed by over 1,000 GPs in our region and about 450 practices. So a huge number of COVID positive patients in the Northwest region have actually been managed by general practice, about 70 to 80%. So whilst COVID monitor has been in use in the other pathways, it hasn't really been tested with general practice usage. And so what we're hoping is that we're absolutely working with the vendor to continue improving over time as we start getting more people using the system. So there are some things that aren't going to be perfect, but things that we want to work with you to make better as we move along in the rollout of this program. You can request discharge from the program directly, and the other two things is you can enter symptoms on the patient record as part of your consultation. So if you're entering symptoms that you've done where the GP's been calling the patient, you can actually download a PDF that can either be uploaded directly into your clinical documentation system, or you can cut and paste that directly into clinical notes. And it's hoped that that will stop some of the double entry that we know is currently happening. And as I said, you can view both the symptoms that are reported by a clinician whilst assessing a patient, but also patient reported symptoms if they choose to enter them. Thanks, Claire. So the big differences between COVID monitor and Redcap is the patient reported symptom monitoring that I spoke about, and patients attempt a survey daily. They don't need to download anything on their system. It's a link very similar to how Redcap works currently for GPs. They click on the link, they just enter their surname and date of birth, and then answer a range of symptom monitoring questions. And those symptom monitoring questions are mainly clinical, but there's a couple of social questions in there as well relating to a patient's ability to be able to isolate from home. You can access patient assessment, including symptoms. So currently in Redcap, the symptom monitoring surveys, if they're filled out, there's no way for GPs or anyone else in the practice to actually see the results of those or see them over time, but you'll be able to do that in COVID monitor. You can see which patients are allocated to your practice. So at the moment, the individual emails that you're getting from Redcap is really hard to keep a track if you've got several patients currently that you're looking after who are COVID positive, and this dashboard will be you'll be able to see who is allocated to your patient, your practice with COVID really easily. As I said, the ability to upload the symptom monitoring directly into your practice software. You can set an agreed schedule for follow-up, and then people will appear on your follow-up list that can help you manage that sort of day-to-day workflow in the practice. There is a need to log into COVID Monitor because it's accessing patient information. There'll be a two-factor authentication process, and I'll talk about what that means in just a moment. Thanks, Claire. So steps to go live. So we're getting very close to D-Day. We go live with this program on the 1st of December 2021. So there's going to be a transition period from Redcap. So patients remain in the program sort of for 14 days. For anyone who's been enrolled in the COVID positive pathway before the 1st of December, they'll continue to be managed in the Redcap system. Sorry, that should say not COVID Monitor. And it means that GPs will be asking to continue to complete the symptom monitoring surveys until after the patient is discharged. But any patients who are enrolled in the pathway from the 1st of December will be loaded onto COVID Monitor. So there will be a brief period of time, a maximum of sort of 10 to 14 days where patients there may still be Redcap surveys coming to you for completion at the same time we've moved to COVID Monitor. And unfortunately, there's no way around that. Access to COVID Monitor, as I said, is via two-factor authentication. So that means the same as sort of when you're logging into your bank or something like that. Practices can identify which staff at the practice they wish to have access. So we know that in some cases, practices have set it up that certain GPs are looking after COVID patients, so they can be the only GPs that you set up. We know that in some cases, practice managers or practice nurses are really kind of coordinating the work of the practice, so they can absolutely have access. It is recommended that each user has an individual login, but to make sure that everyone's kind of ready to go from the 1st of December, and obviously it's hard to know who is and isn't going to have patients in that time, we will set up a sort of generic login, if you like, for each practice. So using the practice email, we'll set up a password, and then each time you log in, a PIN is sent to the registered email or via SMS to a mobile. So that's really important to note for generic accounts. So that will allow people to log in straight away, and we'll be sending a go live pack to practices later this week that will have the user guides and fact sheets, information, username and passwords to get going, and also a list, a survey to complete for the users that you wish us to add for your particular practice. There's an unlimited amount of users per practice that you can have. Education and support, we'll be holding weekly drop-in sessions probably at a lunchtime sort of until the end of the year as we start to move through to the new system. There'll be the ongoing support provided by their primary healthcare improvement team, so similar to the calls that you've currently been getting, and feel free to call or email us with any questions. And the point I really want to emphasise is as I said, we really want to make this a system that works really well for general practice, and there hasn't been that many general practice users of the system. So we really welcome all feedback on functionality, any bugs that you're finding, so that we can continue to advocate for changes and improvements post go live. Next slide. So just a little bit about the symptom monitoring. So once a COVID positive patient is enrolled in the pathway, they'll start receiving that link to complete the symptom monitoring daily. This includes for patients that are allocated to low risk. Patients are sent a daily text with a link to complete the symptom monitoring survey, and this does feed into the dashboard that I'll show you in a moment that's accessible by practices. Patients, if they are recording symptoms that have anything, a symptom result that is severe, they'll actually be sent an SMS directing them to seek assistance if high risk symptoms, because we want to make sure that some of this is put on to patients to actually manage their care and be involved in their care. So we don't want patients sort of completing a symptom survey that puts them at high risk and then they don't do anything about that. It will flag on the system as well, but it's important that patients get that information. And that's something different to the other programs that actually aren't sending an SMS to patients for that, but we think that's really important. We've had feedback from GPs and users of the system about that. So patients will still be allocated to low risk care by GPs using the current pathway. So a referral will be sent from the assessment centre. GPs, we're encouraging to check in with patient initially for assessment and to coordinate the reviews. But as we said, if the patient's symptom monitoring and is going along okay, and the GP feels that, yes, they know that, you know, patient Bianca is able to do the symptom monitoring and will call if there's any problems, then that can just be managed at how the practice likes and how the GP likes between the patient. So it allows some flexibility with the follow-up schedule supported by the symptom monitoring. Escalation, so if any patient's identified as needing transfer to medium risk or high risk, that is still done outside of the system, the current way that we normally do that. And I'll talk through that in a moment. I think that's the last slide, Claire. Can you just, yep. So I'll move to a COVID monitor walkthrough, but just checking some of the questions before I start that.
Yes, Bianca, we did have one, and I know this was brought up in a previous session as well, but how will this work for cold patients or patients that don't, don't have access to a phone?
Yeah, absolutely. It's a really good question, and something that we have provided to the vendors. So at the moment, one of the limitations of the system is the text message is only deliverable via mobile, and it's only deliverable in English. So we have provided some feedback to the vendor around that. Patients can opt out as well of the SMS, the symptom monitoring, and they can do that at the point of assessment, or they can actually say to the GP, I'm not going to fill these in because I'm busy, or I'm actually quite well, and that can be turned off within the system for the case of those patients that appear on a different report that I'll show in a moment. And we'd be suggesting that GPs check in with them as they have been doing as part of the model currently, which is sort of an every second day check-in. But it's a really good point and something we have fed back, particularly for our patient demographics.
Thanks, Bianca. We do have another one that's popped up as well.
Mm-hmm.
Do GPs need to do the survey all the time when they review a patient?
Yeah, so I'll talk about that in a moment. And there's certainly an action that is required, but you don't need to go through the symptom monitoring survey each time. So patients enter symptoms, and there's an opportunity for when the GP is doing a phone assessment with the patient that they can also complete symptom monitoring. That will then, as I said, download that can be added to notes for the purposes of sort of MBS billing and telehealth consultation, but it's not required. If a patient is going okay and they've been filling in their symptoms regularly and they're sort of mild or normal symptoms, then you can just action that there's no further action for this patient. And making sure that you put in an action will help move people off your follow-up list, but I'll talk about that in just a sec. I'm just going to flick screens. I'm actually just going to put myself on do not disturb because people keep messaging me. Okay. So we'll just share the screen, but thank you for the questions. That's great. And feel free to sort of raise your hand if you want to ask any or provide any feedback as we go through as well. So can everybody see that?
That looks
great.
Good,
so this is just showing that this is the login screen. So the email that you register with, the password, and the first time that you enter the system would be asking you to go in and making your own password. And once you do that, you're sent a PIN either to the email, to both the email you registered with and an SMS if you pop that down as well. So here's one I prepared earlier, hoping that flicks. So this is one that I've just logged in, and I'm logging in as a practice, and my practice's name is Test Practice. So when you log into the system, it brings up this report first, which is all of the active patients that are allocated to your practice. So what I'm going to do is just walk through the system. I'm going to give a bit of an overview and an explanation of the menu and the different items. I'm then going to go into a patient details screen. All of this are fake patients. Go into a patient details screen so you can see the information in there, and then talk a little bit about how you would manage the patients through the system. The very similar question around is it expected that you'll do symptom monitoring each time that you contact the patient. So the three stripes up here is how you get to the menu, and this is the menu that you will see as a GP or practice user. So there's a couple of probably what I'd call historical reports. So this all patient reports is something that you wouldn't utilise a lot. What that is that's a report of every patient that has been attached to your practice throughout the use of COVID monitor. So it means any patient that has been COVID positive in the West Metro region, that they have been in the system, and it's a historical list. For our historical list, it will only start on the 1st of December because it's from patients until then, but you'll be able to go back and go, oh, was actually Bianca positive at some point? Yes, she was, and she was discharged or not discharged from the system. So this is a report, all patients that you won't be using that often. Active patients, what that does is that's a list of every patient active in the system, so currently enrolled in the pathway, regardless of what stream they've been allocated to. So you can see this is all the information. All of these all of these columns are searchable, and you can see the symptomatic sort of results of symptom monitoring that's been put in. And there's a section called pathway category. and health provider. So this shows, so care pathway, pathway category, and health provider are the most important here. This shows how many are actually allocated to the GP practice. So that will be your practice that you're looking at. How many are low, and GPs look after the low patients. But you can also see here that there's 2 patients that have indicated that they're current patients of your practice, but they're currently in the medium stream and being looked after by other health services. But it will help with some of those questions that we get around. I know someone else in the family has tested positive, and I haven't received, I'd be expecting their referral. You'll be able to see if they've said, yes, I do attend your practice, but actually they're being looked at in the other medium pathways. Same here with this one. So that's a list that you'd sort of look at to get a sense of how many patients in your clinic actually are COVID positive. That will be helpful for. The most important lists that you'll be using sort of on a day-to-day basis is the active assigned patients, patient follow-ups, and no observations. So assigned active patients are all the patients that you've received a handover for that you are looking after the patient. If at any point you jump in here and you're like, actually, Jeff isn't one of my patients, or he hasn't been here for 5 years, you can still either let us know or let CoHealth know, and they can reallocate that patient. The very same system that we've currently been using if you've been getting a referral in error or you don't have capacity to look after that patient. So jumping in here, these should all be low, and these are patients that, yes, I know that my clinic is currently managing. It has a range of information. As I said, you can see if they're a pediatric patient or a maternity patient, when they last filled in observations, and that's whether they filled them in themselves or whether a clinician did it. And it goes through a range of the high risk, I suppose, areas of symptoms. It has day of illness, obviously some fake data here. No one's had COVID for that long, hopefully. And whether their vaccination status and whether they've been discharged. So all the patients on here will be active because they're ones currently being looked after in your practice. The other report that is useful is patient follow-ups. And there's no data in here at the moment, but what would be appearing here is any patients that require a follow-up. And there's a number of reasons that they might appear on that list. One, that you've scheduled a follow-up to check in with the patient on that particular day and it hasn't been done yet. It could be that the patient has filled out symptom monitoring and has actually indicated they have a symptomatic rating, if you like, of either moderate or severe, or the patient has stopped reporting. So they've actually been reporting symptoms every couple of days and have actually stopped. So it will be a sort of a thing that you might want to check in on that patient just to check they've stopped because they've chosen that they don't want to do the surveys anymore, but check that they've, the reason that they've stopped. So that's who will appear here. The other list is no observations. So these are these patients, and you can see Khan Low GP as part of the test data has actually never completed symptom monitoring. And that means that it's either been turned off or they've just haven't done it from the start. And these are the patients that you might want to ring up and say, check in how they're going. You might want to do that every couple of days as per the current program, but they're not going to fill in the symptom monitoring for whatever reason, or they don't have that enabled. Is there any questions on any of those reports? We will, as part of the pack, have a user guide that's going out that will explain these in a lot more detail. But I guess the most important ones are the active assigned patients, so that you know who's currently on your books that you're looking after with COVID, and the patient follow-ups and no observations. But I'm just going to jump back in here for a second and have a look at go into the patient details. So to do that, it's just to double click anywhere on the line that has that patient. So this is patient Bianca Bell, and I'm lucky that I haven't had COVID. One of the things that you can do is, again, search for different COVID, more COVID positive patients that are in the household. So, does, my partner that I live with have COVID? I think that they do. I can click on here, and there's no known patients at the same address. So really helpful if you're managing large family groups. You'll be able to click on that and it will actually say that, yes, there's 3 other positive patients in that household. And whatever makeup of that household it is, it could be flatmates, it could be families, etc. But that allows you to see any other positive patients that are currently in that household. This is all information that isn't editable by GPs, but is what is captured within the assessment centre service. So I've had a second dose more than 14 days ago, no dependents, no concerns with my living situation, person's primary language, that I'm in the GP model of care, my health provider, this just is which health service region I sit in, and that I'm allocated to test practice, which is the GP, the practice that I work at. It obviously has detected, so all the patients will be detected, and the last symptom severity that I entered was actually severe symptoms. You can see expected clearance date, last login date, last observation, and last contact. So last contact in this context means once last time something was actioned in the system for the patient. Just going through the patient's timeline, and you can scroll in and out of this, but it just gives a sense of when was the patient positive, so kind of on the 18th of November, severe symptoms added a couple of days later, then mild, now severe again. So you can see that changing over time. You can also see symptom history, and you can see who completed that. So you can see that Bianca's actually put in a self-reported system by the patient, then the clinical team member did that from the practice, and then the patient has done that again. And again, the most recent at the top, and it again gives you a bit of a sense of how the patient is progressing. And this goes through, and there's quite a number, but the range of clinical indicators that occur through the symptom monitoring, which I'll show you in a moment. Again, any of the swab history, there's patient notes history. So anything that every time the care pathway is changed, so we know sometimes that patients start in low and they're escalated to medium, that will appear here. If in this case, I was in Western Health, and now I've been changed back to low risk. So you can actually see where the patient's gone in the pathway through that history. And then the log date. So any action, it says who that's been logged by and what were the notes. And these notes are from the actions that you choose, and I'll show that in the next part of the screen. And then there's also the initial intake. So this is the intake done by the assessment centre. You can download that. And that just takes you through all of the my initial assessment and how I was feeling when I went through the assessment. What I should have said back on the reports, and I was just prompted by this download, is that you can download all of these reports. They then come in a CSV, but if you wanted to be able to download that report to provide that to people in your practice, you certainly can do that. So there's a bit of functionality with being able to download there. So does anyone have any questions so far, I guess, about the patient details and what you can see in that screen?
I don't think there's any questions on the patients.
Mm-hmm.
We do have one about each COVID positive pathway be using the same instance of COVID monitor, which I know came up as well. Great question.
It's a great question, and the answer is a little bit complicated, so bear with me. The West Metro pathway works very much in a partnership approach. So all of the hospitals in West Metro, Royal Melbourne, Werribee, Mercy, Djerriwarrh, also known as Western Health, the Royal Children and the Royal Women's, are all using one instance of COVID Monitor, because this pathway has been set up very much for all of those hospitals to work as a group, which means that as a practice with a patient in the pathway, it doesn't matter whether they're sitting in the Western sort of catchment or the Royal Melbourne catchment, you'll be able to see all of those patients, which is really useful. Similarly, the hospital can see at any one point patients in another hospital sort of catchment or care, which really helps with that collaborative approach. We do have other pathways in the Northwest Melbourne PHN region, and they don't nicely fit, unfortunately. So there is the Northeast pathway, which has the hospitals of St Vincent's, Eastern, Austin, and Northern. Those practices, that health service partnership have set up single instances of COVID Monitor. So Northern have one, Austin have one, Eastern have one, St V's have one. That's how they've set that up. And because the difficulty for that is the answer to your question, which is they all have different ones. So if you're a GP that maybe sits in Hume, or a practice that sits in Hume, you may have patients in the West Metro, which means this version. You may have patients in the Northeast pathway, which means another version. At the moment, we haven't done any communication about the Northeast pathway because that hasn't really been clarified by particularly Northern Hospital at the moment, that are still working through what is going to be the role of GPs in their program. Similarly, for COVID Monitor, we haven't done any training around that because we're not quite sure how that's going to work. There's some work that Northeast are doing to further develop that. I guess I would say from a PHM perspective, we are advocating strongly that we have a consistent program, particularly for what's expected for GPs across all, and that we would love one COVID Monitor, because absolutely appreciate logging into different systems is going to become a real pain. We continue to advocate for that, and I would be continuing for people to keep providing feedback on the difficulties day to day that's going to provide for practices. So acknowledge that that's absolutely the case, but at the moment it is different for each pathway, unfortunately. So the options that we have down here, and I'm just going to flick to my notes here. So talk a little bit through about what are the action options, I suppose, that you have in the patient details. There's these 3 dark blue buttons, and they're the actions, and that's what created down here these notes that automatically come in here. So what we'd be suggesting is that each time you have any contact or interaction with the patient, you enter something in here. So it could be that, for example, you've seen that this patient's put in severe symptoms. You want to contact the patient and check how they're going. So you click on there, contacted the patient, and the outcome of that, which could be spoken to me, I accidentally put in the wrong symptom. That's not, I'm actually feeling quite fine. So it could be no escalation required, continue to monitor. And so you would just keep checking in on the patient as sort of required. It could be that, no, I've checked in and actually the patient is feeling quite sick. And so I would I need to clinically escalate that patient. You click on that as per the escalation pathway. When I click on that, I don't want to do it just at the moment because it will lock me out of some other things. But if you click on that, it comes up exactly the same as Redcap, saying you need to contact the patient's local health service, and has all the numbers of the patients there. So if you click that, it will direct you. Similarly to the social welfare, if you're clicking that and you're like, actually, I'm concerned about their ability to isolate, they're not safe at home, or whatever that situation might be, when you click on that button, it will bring up the co-health social support number, so that you have that. It's really important to note that at the moment, just while we're transitioning to this new system for both general practice users and also hospital users and assessment centre, we're not doing escalation within the system. That still has to happen without the system. But if you click on either of those, they will come up with those options. There's the ability to send an SMS, and this isn't a configurable SMS, but we would like to have that in the system. What that means is if you were to press this for a patient, it could be the patient's like, oh, yep, I accidentally deleted the survey that came through this morning, send it through and I'll do it again. And if you press that, it sends an SMS directly to the patient for them to complete that symptom monitoring survey. Schedule follow-up. So I might speak to the patient, decide that they're okay, but I'm a little bit, I still want to keep an eye on them, so I might check in with them on the 26th. That then changes the scheduled follow-up date here, and on the 26th, they'll appear on the follow-up list so that I can remember to do that. So that's kind of all in one spot in the follow-up list. Record notes. A totally optional field if you want to be recording notes. We know that some practices have set it up that different GPs are doing different calls on different days. You might want to leave a note for your colleague in this system. It's not compulsory. It's just there if you wish to include that, and that will come up down in the notes section further down here. You can request clearance or discharge. So there's a number of reasons that might happen. We know that sometimes once a patient's been referred to a GP for care, they actually decide that they don't want to no longer be part of the program, so they can withdraw consent. You can be unable to contact the patient. So in that case, the circumstances are the same as they are now. Complete this like you would the Redcap survey, say you're unable to contact the patient, and send an email to the Western Public Health Unit. So that remains the same, and that information will be on our the one pager that we update with COVID monitor information. So there's a number of different options within there, and they will then appear on a clearance list. Patients can choose to have the symptom monitoring surveys turned off or turned back on again. So requesting no text messages, it does give an option of the reasons as to why. It may be turned off before they actually get referred to the GP. So it might be turned off as the person asked before, because they're non-English speaking or don't have a mobile phone or are going to really struggle with being able to do that. So that'll be really clear if they've got SMS turned on or not. And you can choose to record patient symptoms. So I just want to click on this for a moment. So in answer to the person's question, you don't have to do this every time. If the patient is doing it themselves and they're going along okay, and that's fine, you can actually sort of just jump out of this for a second, say that I've assessed the dashboard and I'm fine that I'm not doing any action. So they don't need any follow-up at the moment. So that's something that you can choose. If you wanted to give the patient a call and go through the symptom monitoring, you can complete this. I'm not going to do that now. They're drop-down options, and these are the exact questions that a patient receives through their symptom monitoring that's sent via SMS daily. And it's trying to ask questions as, I guess, as in plainer language as possible around, are you feeling, back to normal, better, same or worse, more tired than normal, with some explanations around that. Any muscle aches and pains, normal for me as an option. So it just tries to make it as, I guess, take out some of the, make it as easy for patients to use as possible and to understand what the questions are asking. As a GP, if you went through and answered all of these questions, you can schedule follow-up directly from here, so you don't need to go back in. But if you're like, I've checked on you, you're doing okay, I'm actually going to schedule a follow-up to catch up with you next Monday, for example, you can do that. Again, that doesn't link to your practice software, unfortunately, but it does appear on the follow-up list. You can add additional notes if you want, and record observations. The other thing that we've built in, which was some feedback, is that often the patients in a low risk category, maybe double vaccinated, may actually be asymptomatic throughout their disease. So if you speak to someone like, actually, I feel fine, I don't have any symptoms, if you click the asymptomatic button up here, it does actually fill it all in as per normal for you. And you can record observations. And I just want to show this because it comes up in that the downloadable PDF. Hopefully this works. Can you see the symptoms now? Yeah, great, thanks, Claire. And so it's literally just what was answered, but it can be used. You can either upload this or directly sort of cut and paste into your practice software, so you don't need to double enter that again. Hopefully I'm back to the screen now. So any questions on any of that? And I can talk through a little bit more in detail about sort of documenting the telehealth escalation, etc. But any questions?
Nothing's popped up in the chat, but if any of the attendees want to raise their hand and come off mute, I can assist in that as well.
So I guess while people are thinking of questions, and I think it's really hard until you start to kind of get in and have a bit of a play, me talking at you about the system is a little bit tricky. So hopefully it'll start to make some more sense when we send out the go live packs. One of the things I just wanted to talk about was the notifications that are sent. So when a patient is allocated to a GP as part of the low risk pathway, they are sent an SMS that says you've elected to be managed by your GP. The practice name is Test Practice. Please contact them to make an appointment. So what we're trying to do is put a little bit of that back on the patient. The patient has said, yep, I want to be monitored by my GP. They're low risk, so they're able to do that, and encourage the patient to make an appointment with you to start to sort of fit those COVID calls, I guess, in at a time suitable for the practice, ideally. There is some notifications that come through about severe symptoms. So at the moment, the system is set up to be very practice-based, not individual GP-based, which Redcap is. What we're working with the vendor on, and it won't be ready for go live, but we're hoping soon after go live, is the ability on this, say, active practice list, so active assigned practices, to actually add, for a practice to add which GP they've assigned that patient to. So if you're a clinic that works on individual GPs looking after individual patients, you can include which is the GP here to do that. If you're a clinic that has it set up in a different way, that one say GP per day is making all the calls, then you might not want to use that. But at the moment, it's very much set at a practice level. What that means is if a patient puts in something that comes up with that symptomatic sort of score or ranking, if you like, as severe, they will receive a text message indicating that they should either contact their GP for an appointment or call 000. And so that does go back to the patient. What will also happen is they will appear on the follow-up list, and for really severe, so there's 21 sort of questions in that symptom monitoring. For 4, what's been indicated by the task force as really severe, so coughing up blood, severe chest pain, a message will be sent, as I said, to the patient, but also to the mobile number associated with the practice, so mobile or email. That's really important at the moment when we've got that practice view, to know that that's where that message will go. From the clinical information that we're sending out, we are suggesting that if a patient indicates that they have a moderate symptomatic rating, we'd be suggesting that the GP contact the patient that day or the next day. If it comes up as severe, we are suggesting that the patient is checked in with on that day, if possible. So there will be some guidance that's coming out around that, because I guess that's something that's very new that we haven't had as part of Redcap and the model previously, is that addition of the symptom monitoring and what that means. The other thing that we do want to test, and that I'm not sure when we're going to be able to get this, is actually a daily summary report. So a daily summary report that's sent to the practice that says these are the new patients that have been assigned to your practice today, and will prompt a login to COVID Monitor. So it won't have any identifiable patient information within that, but will say you've received, you've been allocated, 2 new patients today. Someone can jump into the system and say, yes, that patient is ours, or perhaps no, they're not, or yep, both of those patients are ours, and I'll then work with our internal systems to allocate that to a GP, depending on how the practice has set that up.